Hello everyone, I'm Dr. G.S. Jammu, and today we are going to discuss one of the very important topics in bariatric surgery, which is called as mini gastric bypass surgery, also known as MGB or OAGP. Well, friends, mini gastric bypass surgery started about 23 years back, and there are very good benefits of this surgery. So, in this video, we are going to discuss what all benefits we have from this surgery, what are the precautions we have to observe, how this surgery is technically performed, and what should be the BM of the patients. And so, I'll try to answer all these common questions. So the things you must know whenever you are undergoing any bariatric procedure per se, mini gastric bypass surgery. So the first is weight loss. So whenever a patient is coming to us for weight loss surgery, the main question in their mind is how much weight they're going to lose and whether they are the candidate for this weight loss surgery or mini gastric bypass surgery. So before that, I would like to tell you what should be your ideal body weight. There are so many scientific formulas, but the best and the easiest one for any person layman can calculate what should their ideal body weight is a very simple formula. You calculate your height in centimeters. Say you are 6 feet, that means you are 180 centimeters. So subtract 100 from it, that is you are left with 80. 80 kilos should be the ideal body weight. Of course, yes, plus minus 5 kilos. If you want to convert this kilograms into pounds, you have to multiply 1 kilo is equal to 2.2 pounds. So 80 multiplied by 2.2 is your weight in pounds. So for patients who want to undergo weight loss surgery, mini gastric bypass surgery offers better results as compared to the other procedures which are commonly performed, that is sleeve or standard Roux-en-Y gastric bypass. Because we have enough data and statistics to show that the patients who have undergone mini gastric bypass surgery for the same weight and the patients who have gone other surgeries like sleeve or lap band or Roux-en-Y gastric bypass surgery, uh, the comparison we found that the patients who were offered MGB have lost more weight and they have maintained the lost weight for a longer period of time. So one is a weight loss, and how much is the weight loss? Say it is almost in all my patients we see about 80 to 90% of excess weight loss is there. So what is excess weight loss? That means if you are overweight by 100 kilos, you end up losing 80 to 90 kilos. So that is your excess weight loss. So this is the first thing, you are going to lose this much of the weight. And it also depends upon your BMI. For super obese, for super obese, for a younger age group, for higher BMIs, you lose more weight as compared to lower BMIs, and with increasing age, the weight loss is less, unless you are suffering from other medical issues. So the second thing is that diabetes, which is a very common metabolic problem, and diabetes, especially type 2, it goes into remission. By remission, then it goes into state of resolution. You stop taking medicines for the type 2 disease, for the diabetes. Even if you're insulin, you might stop taking insulin, and this is I would say the magic. So for the diabetic patients who are HbA1c levels, they keep on increasing. They're above 7, 8, 9, 10, 11. What we observe, the shorter the duration of diabetes, the better the resolution, and sooner they go into state of resolution. So diabetes goes into resolution. Then is high blood pressure, or medically we call this hypertension. The patients who are suffering from hypertension, they also have they normalize. That means they become normotensive now. Their blood pressure level starts falling down. Then there is dyslipidemia. Dyslipidemia is a medical term for imbalanced high cholesterol levels. So the bad cholesterols, which are called as triglycerides or LDL levels, they normally increase with obesity. So they'll also start normalize. Most of the people who have high blood cholesterol levels, they start taking statins. So once you have undergone mini gastric bypass surgery, your cholesterol levels start falling, and in about a year or so, they almost become to the normal level. So this is one of the additional metabolic good effects of mini gastric bypass surgery. And again, as I told you, the mini gastric bypass surgery, the results of maybe the weight loss or maybe the resolution of metabolic problems like diabetes, high blood pressure, or cholesterol. Uh, there's more resolution as compared to the other procedures. If the other procedures offer results to the category of 50 to 70 to 80%, meaning gastric bypass is offering to the category of 90%. Snoring and sleep apnea is a common problem which is observed in patients who are obese. So what I have seen in my own series of 5,000 plus cases, that patients who have undergone this weight loss mini gastric bypass surgery, the snoring or sleep apnea in more than 97% of people, they have stopped snoring and sleep apnea has gone away. They have stopped using the gadgets like CPAP or BiPAP, which often people who are suffering from sleep apnea have to use. Last but not the least, the cosmetic result. Yes, this is an indirect benefit. Once you start losing your weight, you get better into shape, you start looking smarter, and self-confidence improves. You start have more, you start socializing more. So these are the additional benefits of mini gastric bypass surgery. There are other things to be known, which are the technique of the surgery. The technique of the surgery is done laparoscopic method. In the older days, the surgery was being performed with open technique by having long cuts, but now we have a laparoscopic. And in laparoscopic also there are so many advances, like we have standard definition cameras, we have high definition endovision cameras, we have 3D technology. So in our center in Jammu Hospital Jalandhar, we do all these bariatric surgery procedures with 3D technology. As you can see in this picture, me and my team are using some goggles, and these are made for this interface become 3D on this endovision system. The benefits of 3D technology is that surgery becomes easy for the surgeon, and the indirect benefit goes to the patient because surgery would last a shorter duration of time. There's more exactness, or it is performed in lesser period of time without training on the surgical team. So these are the good benefits. Again, the time taken to do this mini gastric bypass surgery is about almost 30 to 40 minutes. Hospital stay is going to be just 48 hours, that is 2 days. The best part of mini gastric bypass surgery is that this is probably the only surgery which has so many exit routes, and it's totally reversible surgery. By reversible surgery means nothing is put inside your body and nothing is being taken outside your body. Unlike if we see the lab band procedures, we put a elastic band on the stomach, which is a sort of foreign body. In procedures like gastric sleeve, we take out part of the stomach out of the body. But in this mini gastric bypass, nothing is being put inside, nothing is being taken outside. By just changing the configuration from a bigger stomach, we are making a smaller stomach. And another thing, we are just bypassing some part of your small intestine. And if there are any medical issue or due to any reason, the surgery is easily reversible. By revisions, we mean if you want to lose more weight, we can still make a longer bypass. And if you have lost more weight than required, we can shorten the bypass. So there are so many exit technology or exit strategies in mini gastric bypass surgery. Then we come to what is basically configuration. As you can see in the picture shown, this pink color is a balloon like thing which is the stomach. Stomach, we all know, is that reservoir of organ where the food gets stored, and it is the main cause of hunger in everyone. So whatever food we are taking from the mouth, it goes to the food pipe, which is called esophagus, into the stomach. So the stomach has to be full. Once the stomach is full, the signal goes from the stomach into the brain, and we stop eating. And so people sometimes used to take more calories than that was required for their than it is normally required for them. In mini gastric bypass surgery, the first step done is we reduce the size of the stomach. As you can see, from a bigger stomach, we are making a small tube of stomach. The red arrow is you can see is the food which is going into the smaller stomach now. And we have different lengths of small intestine varying from 6 meters to about 12 meters. The second thing which is done in mini gastric bypass is we bypass some part of the small intestine. So in this case, the loop you can see the green arrows is a loop which is bypass. This bypass is a small intestine. It comprises of duodenum, and some part of the jejunum. So depend, this is tailor-made bypass depending upon the BMI of the patient is made. If patient is very big, the BMI is more, we do a little more bypass. The standard bypass length varies between 150 centimeter to about 2 centimeters. Sometimes we have to make shorter bypasses, or sometimes we have to do a longer bypass in exceptional cases. I will not go into those that technicalities, but just to make you understand that two things are being done. One, we are reducing the eating capacity of the stomach by stapling it, and we are decreasing the absorption by bypassing some part of your small intestine. So how this configuration is made, I have tried to draw a picture, and you can see in this video. Please accept my apologies, I am not a very good artist and a very bad handwriting. So like I told you, we decrease the calorie intake by reducing the size of the stomach. How it is done? This, the red color, is the stomach I'm trying to draw. So this is normally a balloon structure where the food from the food pipe goes into the stomach and gets stored and broken and then is pushed into the intestines. Normally, before the surgery, this green crosses are the food which we have to consume. Once the stomach is full, we stop eating because the signal goes from the full stomach to the brain and tells the brain, yes, I'm full, and we say we are done and we stop eating. This is the normal thing. So the first step is to cut this size. So the early signal goes to the brain and brain tells us, stop eating, man, you are full now. How that can be done, you will see in the second picture. We try to reduce the size of stomach by stapling it. So again, this is the stomach. We have the blue thing, the blue dots is the now staples which is put. The stomach is divided in two parts now. This is a new 1/3 stomach which will be part of our digestive system. This 2/3 stomach is the residual or the redundant stomach. So 1/3 stomach you have to full, which is easily done with lesser amount of food, and the other 2/3 food we don't have to take anything because it is not a route for the food. Now it is a bypass stomach. So you fill your stomach with these dotted green dots. This is our food, and the signal will go to the brain. Yes, I'm eaten. Now I'm full, so stop eating. So this is the first step in the mini gastric bypass surgery. The second step is to reduce the absorption of the food in the intestines. So how that is done, I'll show you in the next picture. So this is the second step, decreasing the absorption of the food. So this is a smaller new stomach, and lying by right side is a bigger bypass stomach. So now all the intestines are still attached to the bypass stomach. We want to reduce the absorptive part. So these are the intestine which may be variable in length, 6 meter to about 12 meters. Say in this particular patient, we want to do a bypass of about 200 centimeters. So we start measuring the 200 centimeters, and this patient has a body mass index of 50. For 50 BMI, normally I would do 200 centimeter bypass. So we measure 200 centimeter distance from the starting point of the small intestine, and this A point is the 200 centimeters. This A part of the intestine is now dragged and attached to the new stomach. The blue line you can see is the food which is entering from the new stomach into the new attached part of the intestine. This dotted segment you can see is a bypass stomach and bypass small intestine. So we have literally bypassed the stomach, we have bypassed total duodenum which may measure about 20 centimeter, and we have bypassed jejunum depending upon how much bypass you have thought in your procedure to be performed. So in this case, if 200 centimeter bypass, that means we have reduced the absorption of the food in 200 centimeters. So supposing this patient had intestine of 10 meters, or then bypassing 2 meters, that means the absorption which was initially occurring in about 10 meters is now occurring in only 8 meters. So we have reduced the calorie intake in the before picture. You have to full your stomach by eating this much amount of food, and there is no bypass at all. The food is going to the whole of your system. In the after picture, you can see you are eating almost one third of the food, and your stomach gets full. Signal goes to the brain tells you don't eat further, you are done, and you are bypassing some part of your small intestines, because if some high caloric thing you are eating, it's not being absorbed fully into your system. That is why after this surgery we tell them, all our patients, to take multivitamins, because sometimes the absorption of multivitamins also decreases. So we tell them to take a multivitamin dose every day. So there are few challenges also in this surgery, and you have to be careful once you perform this surgery. The challenges are, what kind of diet you are going to take after the surgery. Now we have reduced the intake of diet, so we want you to take a proper diet, a healthy meal which should have considerable part of non-vegetarian stuff if you are non-vegetarian, or a high protein stuff. If you are non-vegetarian, you can take eggs, chicken, fish stuff. If you're a vegetarian, you have to take a good protein diet like tofu, and you have to take milk, you have to take yogurt, you have to take curd, sort of things which are high in protein. Then you have to take fiber in your diet. The things you have to be careful which you must avoid in your diet are the sweetened things like sweets. They can give you dumping. We'll discuss what is dumping in maybe next video. So to avoid dumping, you should have less of sweets, less of carbohydrates, less of bakery products. And all the fruits are good, except for which are foods which have very high glycemic index. You should cut down on those because they have a high calorie, and the sweet thing in that can give you sometimes dumping. Then you can have all the green vegetables, all the pulses, cereals you can easily take. The medicines, because we have decreased the absorption of food, there's going to be decrease in the absorption of some good vitamins as well. So we tell you to take a vitamin every day. That should have vitamin B6, B12, B1, calcium also, and iron also, preferably. Yes, the surgery is going to help you lose and reach your ideal body weight, but sometimes there's a tendency for people that they do not work out, they start consuming very high caloric stuff. So the carelessness may let them increase their little amount of weight. So even to avoid that, if you want to maintain your sustained weight loss, you have to do little workouts in your daily regime. So you can add about 30 to 40 minutes workout every day, at least 5 days a week. Follow up, yes, you should follow up because some blood work is required at least once a year. If you are placed overseas or distant places, you can always contact with your doctor either through email or something, and there's some blood work to be done which can be done anywhere in the world. So you have just send the investigations to your doctor, and they'll send you the plan of action on that. Motivation, yes, patient who comes to the hospital for this weight loss surgery, they should be self-motivated because this surgery is really demanding. So we tell the patients that the surgery is really going to be a game changer for you, and you should be self-motivated. Surgery should not be performed under compulsion by the parents or by the spouses. So one should be self-motivated. Otherwise, it's easily tolerable surgery. But yes, because you have to take some medicines, you have to do blood work once in a year, so you should know all these things. Then comes the risk, which everyone wants to know. What's the risk of the surgery? Well, this is just like any other surgery with no added risk. Rather, once you undergo this surgery, as you start losing your weight, you come in a normal zone or the safe zone of your life, and your risk to your life will decrease. So again, risk as like any other surgery. Rather, it's less risky than most of the surgeries, like any cancer surgery being performed, or some hysterectomy or a hernia. It has less complication or less riskier to the life. So these are some kind of results. You can see this young lady losing 137 kilos to 87 kilos, and with the permission of this particular lady, I'm showing her pictures, and she's from Canada. She was married for more than 7 8 years. She had previously undergone some surgery, probably lap band, and she did not lose much weight. She came to us. We did mini gastric bypass on her, and she lost considerable weight. And just after I think 2 years of surgery, she was able to conceive. Now she has a healthy baby. She can be contacted over phone as well. Her name is Archie. This is an example of another lady, and from 108 kilos to 69 kilos, and these photographs are being used with the permission by these patients. So this gentleman from 208 kilos to 125 kilos, and I hear that he has further reduced the weight now. So I hope I've been able to make some concept of this mini gastric bypass surgery. I'm still sure there was maybe so many queries or questions in your mind. So please feel free to call me at my WhatsApp number or message me at my WhatsApp, and you can also email me. If you happen to like this video and if you want more kind of these videos, please let us know. And your feedback is really will be very motivating and appreciable. This is then my YouTube channel. You can even subscribe that if you want more information on this. Thank you so much.